Hello, everyone. My name is Nicole McCallister, and I'm one of the social workers here at Ironwood Cancer and Research Centers. Thank you so much for joining me today for our Lunch and Learn series. And today we're going to be talking about Social Security disability. We are live, so I will be taking questions at the end if there are any. But I'm going to go ahead and get started. So Jessica and I are the two social workers at Ironwood right now, and we assist patients with the different ways in which you can apply for and qualify for Social Security disability. And so I'm going to start off by sharing my screen because I want to walk you through all the steps and show you hands-on how you do it. So important thing to remember whenever you're doing anything with Social Security is make sure when you're going to the website, it has the .gov, .gov on there. It's really, really important because you want to make sure that you are not going to some spam channel or some advertisement. If you were to just open a Google page and type in Social Security disability like I'm doing right now, first things are going to pop up are ads, law firms, people that'll say, oh, you need a lawyer to apply for disability and you can't get in. If you click any of these, like it's going to trigger, a lot more stuff. And we don't want you to be spammed. We don't want you to get duped by anybody. I always tell patients, no one from Social Security will ever call you and ask for your information over the phone. Occasionally patients do apply for disability and online, and they make an appointment with Social Security to do that. And that's okay. They're going to call you right away, but no one is ever going to call you and say, give me your Social Security number, or I'm not going to give you your check until you submit this information. That is spam. That is someone kind of collecting that information inappropriately, and you should record any number that comes into your phone where someone's asking for that and report it to the Social Security Administration. So it's really important to be safe, especially when you're giving up so much personal information. So this is the main page of Social Security. And as you can see, there's different services online. Most offices for Social Security Administration do not have employees that are working in person that you can go to and see in person and just walk in. I would say a majority of their staff are still at home working virtually. They've converted a lot of positions to virtual positions. So it's just a lot easier that way. But it is strange when sometimes when you call and talk to them, you'll hear chickens or like a kid or a dog or something. Hopefully they're following through with their things for privacy. They're required to. So usually a dog isn't going to share your information. So here's the main page. So this is where you would click if you had questions about retirement. Here's questions about SSI, which is Social Supplement Income, and we're going to talk a little bit about that, Medicare or disability. So we're going to click on disability, and it's going to take you to the main page. So there's a ton of articles that go over the basics about the benefits you'll receive through disability, all the different ways in which you can apply for disability. So you can go online by phone through their 800 number, or it says in person. Unfortunately, the in-person really isn't an option right now. So it's really online or by phone. And I will give you the 800 number that you can call Social Security at, but it is throughout this website. But the number is 1-800-772-1213. So this is a very important piece of this application process. This is the checklist that says what you need to know to be ready. So I'm going to make this big because we're going to kind of go through each of these steps and explain them. And I'm going to move my little picture out of the way. So this is all the information that you need to know before you even start your application, or if one of the social workers is going to be assisting you or someone else is going to be assisting you, then you need to know all of this before you start, because the process, even when you know all your information, is about an hour and a half. but you won't be able to finish the application unless you can answer all these questions. So first things off is you need to know your birth date and your place of birth. If you're born outside of the US, you're going to need your resident card or other paperwork that shows you're a US citizen or that you have residency here. It may also contain a different name because you might have been born John Miller or Josie Miller, but now you are Josie McKenzie. So through marriage or name change, it happens. My grandfather changed his name when he was adopted by his stepdad. So McCallister is not, I guess, technically the birth name for me, but people sometimes have circumstances. So you need to know your name at birth, your place of birth, and your correct birth date. You also need to have the information of any current spouse, so name, date of birth, when you were married, like the day you were married, the place you were married, and what type of marriage did you have. So was it religious, ceremonial? If you don't have your current spouse's date of birth or Social Security, it's optional, but the more information you input up front, the easier the application, the quicker the decision making, the less kind of work that goes on the back end. So I always tell people, look at this checklist, be prepared, ask your spouse what their date of birth is and their Social Security. If you have been married in the past, you need to list any marriages that were 10 years or more, and it is exact. I once had a patient who, when we inputted the date of marriage and date of divorce, it was 9 years and 11 months. So the Social Security said, we don't need to know that. It's only 10 years or more that they need to know about that, because they're looking to see if you're eligible for any benefits if they passed away, or if they are eligible for benefits from you. And so they kind of need to know that information. So again, name of current spouse or a prior spouse if the marriage lasted more than 10 years or it ended in death. Their date of birth and social would be great and best, but it's optional. And then the beginning and ending dates of your marriage, where you got married, and what type of marriage it was. Then it's going to ask you about your children, and if you had any children that became disabled prior to the age of 22, if you have any that are under the age of 18 and unmarried, or are age 18 or 19 but still attending secondary school full-time. So they're looking to kind of see that information. It's going to ask about any military service you had, what type, what branch, what dates. Then it moves on into the employment section, and this is so important, and it is really hard to remember. So it's really important to create your Social Security, my Social Security account, and we're going to show that. But again, we're at the point where we're just gathering information to be prepared for the application. We haven't started the application yet. So it's really important to know the current year and the past 2 years. So right now, if you were going to go apply, they'd want to know any employment, any income information for 2022, and then 2021 and 2020. Those are the most important, but they can ask, and usually do want, information that goes for employment for the past 15 years. And so really knowing who you worked for, an employment start and end date, and what your earnings were. Were you making $15 an hour? Were you making $2,000 a month? Were you making $50,000 a year? Whatever it may be, they just kind of need to know. If you have to estimate any of this information, there is an option where you can put like a note in saying, I don't recall the exact start date or end date, but it was spring 2019 or fall 2008. So you can kind of make a note of that, but the more accurate the information you enter, the easier it is for your application to flow through the process. We want you to get in, have them have all the information they need, and for them to make a quick decision about your disability. So that's all the information they're going to need. If you are self-employed, they're going to want to know all of that. What type of business, what was your net income? Now, this is a very important piece, direct deposit. It does require, and it will not let you move forward in the application process if you do not enter a savings or checking account with the account number and the bank routing number. Social Security only pays benefits through direct deposit, so it needs an account either in the US or an international bank that has the account number and the routing number. And for the international, there's a few more things that you'll need, but you have to enter that information so they can pay. And it needs to be an account that your name is on. Social Security is not going to pay it for someone else. So if you have separate accounts or you don't have one, you might need to go get one in advance. This lists an alternate contact for somebody who knows about your medical condition and help you with your claim. I know with the patients that I assist, and I don't know if Jessica does this or not, but occasionally I add myself as their alternate contact because I have access to your medical records and I can answer questions with your permission about everything that they need in order to make this run smoothly. Sometimes you use a spouse. Spouses are really good. Caregivers are really good because they have all your information. So it's who you feel comfortable with. So this is the basic information they need to just see if you qualify based on employment history. And you do have to have worked and paid taxes for a period of time. You have to earn so many credits. Disability doesn't happen just because you're a resident, just because you have a medical condition. You have to have paid taxes. You have done it recently. You have to have income. And then your disability and the amount is based on the income that you've earned. Once they kind of clear that, they start looking at your medical conditions. So this is where it's really helpful to have all the information about doctors, hospitals, any healthcare professional you worked with, especially in pertaining to the condition that's causing you to be disabled. So for example, if you have a cancer diagnosis and that's why you're applying for disability, you definitely want your oncologist information, any hospitals where you had a surgery or a biopsy performed, and you want to know the name, address, phone number. If you have a patient ID number, if you have the care portal, you can look up your patient ID number, dates of examinations or specific treatments. We always put big things like biopsies, scans, surgeries, tests that have been performed, pathology tests, different things to find out about the cancer, and then all the different medications, prescription and non-prescription, and the reason for them and who prescribed them. So that includes your chemotherapies, immunotherapies, just different targeted stuff that we give you, oral chemotherapies. If you're having extreme nausea, are we giving you medicine for that? If you're having extreme diarrhea, are we giving you medicine for that? If you have other conditions related to the side effects or treatment, and we're giving you prescriptions for that. They want to know all of that. They also want to know if you have records in other places, such as voc rehab, workers' comp, public welfare, if you've been in prison or jail, or an attorney that's worked with you that's holding records. They want to know all that. Then it's going to go into your job history because they want to know what type of work have you done and when were you at a point where you had to stop working or your work had to be modified because of a condition, and are you still working right now and how many hours? They want to know what types of duties you did on the longest jobs you've had. They want to know, were you a physical worker? Were you doing manual labor all day? Were you in a call center where you're just sitting making calls? They just kind of want to know that information to know a little bit about you and your history with work. And then it's going to ask about education and training. So a good thing to do is to go online and at least print out this list. And before you're ready to apply, is make sure you know all of this information and can provide that. So now we're going to go back to this main page. Move me out of the way. And again, this is going to go over all the information you need to apply, benefits, other ways you can apply. You can make an appointment with a Social Security disability representative to complete that application online. We do encourage that you do that to kind of be independent and do it yourselves. We do encourage people who have stage 1 or stage 2 cancer to make those appointments and complete it with a representative. Or if you're continuing to work and you haven't stopped working because of the condition, then it's better to apply directly with Social Security. We generally at Ironwood assist patients with the application process when they have stage 3 or stage 4 cancer, or specific types of cancer, or you don't have like a computer or technology, or you can't use it, or you can't get on the phone, but you can come into the office and sit with us, or sometimes we do it over the phone where you're giving us all the information and we're inputting it, but we prefer to do that in person. So again, this is the process. So you get all your information together and you get through. Once you've applied, they kind of review it, they contact you if they have any questions, and then you can go in and check your status and see how it is. If you call to check your status, they are open Monday through Friday, 8 a.m. to 7 p.m., and I believe that is the Central Time Zone. However, you might be on hold for up to 50 minutes. That seems to be the average wait time. If for some reason you get a denial, and this does happen a lot with individuals who have stage 1 or stage 2 cancers that apply, they get a denial. If it's not because you don't have work history or credit, but they're saying like maybe your medical condition doesn't rise enough or they don't have enough information, you need to do an appeal. We do not help with appeals. It's not our role. We're not employees of Social Security. We just have been doing applications and assisting patients with the initial applications for a long time. So we have a lot of experience, and we've learned some tricks along the way, some tips on just typing in stuff. So we help with that. If you have stage 1 or stage 2 cancer, it's likely that it's going to take 6 months on average before you get a decision and start receiving checks. There's only a few conditions, and not even all metastatic sometimes qualify for the expedited referral. In the past it has been, but we have seen some recently where they're not getting checks. Maybe they get the decision within 6 weeks, but they're not receiving the money for 6 months. So this is not a process that's going to give you money coming in very quickly, unfortunately, even though it is your money that you've paid on and paid the taxes on and invested in. This is not a slow process. There's lots and lots of people that are applying for benefits and assistance and disability. And so the federal government makes these decisions. They coordinate with the local Department of Economic Security to kind of process and look for information to support you getting disability. And so that is a frustrating thing that sometimes patients experience is, well, I need the help now. By the time, maybe I get a decision, I might be done with treatment and not need it. The biggest thing to know to get an expedited referral is right here. It says, if you meet the non-medical requirements, so the employment history, the income history, paying taxes, etc., your resident, if you meet those requirements, monthly benefits are paid if you have a medical condition that's expected to last at least 1 year or result in death. That's kind of what they're looking for. Is this like a thing you're going to be done with in a couple weeks, or is this something that's going to take a year? And with a lot of patients, especially with the higher levels of cancer diagnosis, you are going to be in treatment for a while. You're going to be doing maybe radiation, maybe chemotherapy, then immunotherapy. Maybe you're going to be doing other treatments and bone density tests and estrogen treatments and blockers and just a lot of different things and scans, and coming in 6 months to be rechecked. And so a lot of this treatment and this condition isn't going to be done in a year. So those are the individuals who are going to get those faster responses from Social Security. So again, you can apply online or by phone. Click on here to get that disability checklist to be prepared. When you're ready and you come to this main page, again, this is what it's going to look like. And it's ssa.gov. So yeah, .gov. Again, we're checking to make sure we're safe. And you're going to come over here and you're going to click on disability and get started. If you need to create a My Social Security account, or if you've already created one, you're going to start off by clicking here at this sign in, sign up. And here it talks about business, government services, or My Social Security. So My Social Security is a really good information page. It lists all the income that you've earned your whole lifetime. I know when I pulled mine up, it showed all the way back to when I was like 14, working at a little diner at the end of the street. And I was so proud. I made like $800 my first year working. But it went all the way back and showed that. And it just showed my throughout college where maybe there was a dip in income and then it was spiked up. And obviously I graduated and started getting real jobs. So, you know, it definitely captures everything. And I always say, well, if you have all this information, Social Security, why do we have to input all the work? But we do. So, but you do need to create one of these accounts, and it is so important. So if you've already created one and you've done it prior to September 8th, 2021, you're going to put in your username and password. If you don't remember, you can click here, answer some questions, and get that username password resent to you. If you've never created one of these My Social Security accounts, where you're going to start is by clicking on login.gov. And again, this is a .gov, so it's a safe website. So here you're going to click on create an account. You're going to enter the email address what you are going to use for you and your account. Now, I know some individuals or couples, I just send everything to my wife's email. You want your Social Security account to be connected to you and your spouse's to theirs. So if you have your own email, you should really use your email. So here you would type your email address, and I'm just putting it in so you can see it. Obviously, I'm not going to create one at my Ironwood email account or show you mine. But you would put in your email account, click on English, Spanish, French, Francais. Then you would click on I have read and accept the terms, and you're going to submit. Now, I'm not actually going to click submit, but here it's going to go into creating like a username, a password, and there's going to be a lot of back and forth where you have to click on your phone and you have to go to your email and it's going to send you a text. And unfortunately, this process right here, there's my puppy, is the most complicated piece because you're going back on your phone and back and forth, but then all of a sudden it'll be done. And then you're going to get to the disability application and you can go from there. On the My Social Security account, it's going to show you right away if you have the credits and qualify for applying for disability. It's also going to show you the amount you're estimated to make upon retirement and the amount you're expected to make through disability. Everything are estimates, so they might change their mind and have something a little different. Even though you say, well, maybe I stopped working on March 1st. But if you documented that you had to modify your work because of the condition, and they can find records to support that and approve that, maybe you modified things in January of 2022, not when you stopped working on March 1st. Sometimes they retroactive that back to that day, and they do give you an amount for that. It's not all the time, and it's not guaranteed, and it seems really random when Social Security makes that decision, but it's really, really important. Some other tips that I would say to know is when you come in and talk to your doctors here at Ironwood, and they're asking, how are you doing? If you're not okay, or you've had bad times since the last time you saw them, do not hesitate to tell them the truth. Tell them you're having pain. Tell them you have to run to the bathroom and sometimes you have accidents because you have no more control of your bowels. Tell them you are so tired all the time that you can't stay awake for more than a couple of hours without having to take a nap, that you can't sit for more than a long period of time, you can't stand for more than a period of time, you can't do this. Whatever is going on with you, whatever concerns you have, we can't fix problems we don't know about. But also it's really important because during this process of disability, one of the things Social Security does is request our records, and they look at what's being reported to the doctor, what the doctor's treating, and how you're doing. So if you go in and say, I'm doing good, no problems, and that gets documented in there, first of all, our doctors can't help you correctly because they don't know the truth, which is maybe you're having some of those issues. And I know sometimes it's very uncomfortable to talk about diarrhea or having accidents or other things, or weight loss or weight gain that is causing you to be fatigued, or other issues that come up. Pain happens. Trouble sleeping and not being able to sleep or oversleeping happens. And those are things as social work we're really concerned about. I always ask, are you in pain? Tell me about your appetite. Tell me what your sleep's like. Because those three things can severely impact your daily functioning. And those are some of the things that we need to know about and Social Security needs to know about to make a determination about whether or not you really are disabled and unable to work right now. So communicating that with your doctor is number one. They can help you. Number two, it gets put in the notes so that that supports kind of your reasoning for that. So always be honest. Always tell everything, and let us see what we can help. Your nurses are great too. They always have good advice on all that stuff. So we have triage lines where you can get a hold of them during the day. We want to be helpful on treating those side effects of treatment and the disease itself. So back to the main page. Again, there's a lot of helpful information on here about Social Security. There's information about benefits and how you can do everything. One of the things that I'd like to point out to people that maybe they don't know on the disability site is it talks about like what benefits can you get that comes with a disability diagnosis. You do not automatically get Medicare insurance just because you go on disability. You have to be on disability for a full 2 years before they will give you insurance benefits. So you have to maintain your own insurance throughout that time, either through a marketplace plan, or maybe you qualify for Medicaid, or you have something private through an employer if you're still working part-time or out on FMLA or short-term disability, long-term disability. So you need to maintain your healthcare insurance during that time because it'll take 2 years before you get that. There's nutrition assistance programs, the Social Security supplemental income, the SSI, that is different than disability. That is based on your household income and your income, and it's generally something that you can apply for if you fall below the poverty level and require financial assistance. So that's something you can do throughout this application and they can make a determination, or you can apply just for that. Again, calling the numbers is really helpful. There's lots of different ways to contact them. There's online services, there's phone numbers. Again, the phone number is available like Monday through Friday, 7 a.m. or 8 a.m. to 7 p.m. But you will wait on hold for a really long time. Unless you're just calling for a technical fix, like you're locked out of your sign-in account or you've tried too many times and now it says you have to like call. When you call, when they say, what can I help you with? Say help desk. Don't say anything else because that'll put you in the quicker queue to get the IT people to assist you. I'm gonna peek down here. Let's see. So again, lots of information on here, lots of facts, like read up, how would this affect your retirement? Check, is it gonna reduce the amount of you start claiming disability or early? I've had patients who were around 63 years old, they weren't getting their Social Security retirement. And when we completed their disability application, they did give them the option to start receiving a reduced retirement check in the interim while they were waiting for their disability determination and paychecks to start. So that was giving them some income right away. And that's really helpful for those. So that's something to consider, but it does kind of affect the overall retirement amount. So on the questions like that, we're going to defer you to calling Social Security because they are the experts of your accounts and your benefits and what you're eligible for, not eligible for. Here again is the application phone number, the 1-800-772-1213. Like I said, most of the offices do not have in-person staff at this time. And it says, although offices are closed to the public, there are people in there using the phone, people working virtually from home. So really your options are online or by phone. If you have any questions about all this process or anything that is coming up, or just kind of talking through if this is a good fit for you to do right now, please contact your social worker. We can kind of advise you about the health insurance benefits and what you're going to have, what you're not going to have. We can talk about short-term disability, like long-term disability, and kind of guide you to your HR department, because they're the ones at your employer that know if you have those benefits and how to access those benefits. And if you have short-term disability, we want you to go there first. If you have exhausted your short-term and now it's time for long-term, we want you to get on your long-term, but then we want you to apply. If your condition's going to last a year or more, or could result in your death, then we want you to, kind of do that. If you're going to continue working, we can advise you that it might be better to complete your application directly with Social Security so that you can kind of talk about all the rules, because they do have limitations on how much money you can earn, how many hours you can work, to still be considered disabled, but receive benefits. We also advise people on how they can get a marketplace insurance if they're going to stop working and have to buy their own, if they qualify for Medicaid based on income they get. There's so many different things to consider. So sometimes it's just helpful to talk it through with us. So we're always available to you. You can reach us directly if you have our contact information. I cover the North and West Valley, and Jessica covers all the East Valley offices. And so we are also coordinated by Emily Wolf, who's our medical assistant, and she works for Dr. Rula. So maybe some of you have seen her in Chandler or Scottsdale, but she could get you to us as well. You can email socialwork@ironwoodcrc.com. You can also call our main line at 480-314-6660 and leave a message. That's going to go to Emily, and she's going to either send it to Jessica or I, depending on who your doctor is and what part of town you're in, so that we can be of help to you. And again, it's always helpful to just talk it out. We can send you the checklist so that you can kind of go over it, and when you're prepared and ready and you know what to do, we can proceed from there. We just want to be a support to you on this journey. We want to help you. We know that cancer is overwhelming and can be a very challenging thing mentally, physically, emotionally. So we're part of your team. We're part of your cheerleading team to kind of get you through this and help you get what you need.